ultimately we believe that all care providers should have several pink kits. We hope you have them. Hypno-baby, hypno-birth, Lamaze, whatever skills-based self-learning, and then ask people to pick which one, and then have them write a skills-based birth plan along with their other birth plans. So they're telling you what it is they're learning, showing you how they're learning it, what they're doing, so that you know in labor that they are actually using skills. So Thursday, Jack said, this woman said, I'm using the pink kit, and then this woman showed her, and the father showed her in birth how skilled she was. Now, if the woman had never said to her that she was using anything, then Jack would have assumed that this way this woman birthed was intuitive and instinctive. I do believe that New Zealand could lead the way if we had a skills-based approach to pregnancy and childbirth for all pregnancies.
Actually, we really need to readdress this again, because what had come out was the Select Committee response to the petition from the Hoover petition, and around about the same time Terry had sent out the email from the college about the health workforce looking for nominations to be on that group, maternity workforce group. The worry, of course, is that, when they're part of the conditions of being on that group is that we're looking at 2020 vision of maternity care in New Zealand. The status quo is not okay, and having to be forward thinking and, be visionary. You know what's coming next is yet another change. And we can keep tweaking the system, but actually it's not the system. Besides a few tweaks, the system will never ever improve when we still haven't got a skills-based program for birthing couples. I think sometimes we get so into our little world of midwifery that we kind of forget to take a step back and know, okay, how can we do this differently? And then the other thing that turned up, because Wintergreen wanted the stats, my stats sorted, and so I thought, I'll send off from the 2009 stats, and what turned up from MMPO was a breakdown of their general MMPO stats, and I was gobsmacked to see that normal delivery rate is now 70% among MMPO midwives, and so that's dropped. So we have a 30% intervention rate. Our intention to start with, when I first got into this, it was to reduce that intervention rate. But what I quickly became aware of, actually it was just one of the spin-offs of having a skilled birthing population, really, skilled parents birthing. So I guess the first question is, is the status quo okay? Do you guys think the status quo is okay? I'm going, when I'm seeing these documents come through. But do we need change? What do we need to shift? In ourselves and being in the birthing population.
If what you're seeing now is unnerving, would you be okay individually, regionally, and ultimately asking your professional organization to support a skills-based approach to pregnancy and childbirth? Now, this goes way against the present modern historical approach to childbirth. The present dialogue has been that the natural birth movement, with very famous authors, that women don't need to be taught how to birth. Cats aren't taught, women aren't taught, you breathe anyway, you don't need to be taught how to breathe, you don't want to tell women what to do, you want to leave them alone to discover birth by themselves. Mothers know best, they'll get into the best position. You know what your message is. Natural childbirth, normal childbirth is best, you want to reduce interventions, that is. And the natural birth movement actually is not the same as the midwifery profession, but it has become aligned, right? Which for people who I worked with were medically high risk, they couldn't perceive of being in a relationship with midwives who were promoting natural birth when they had medical high risk. So they were looking to have skills as families, right? Some of them to try to reduce or prevent the risks that were facing them, but they were doing that within the standard of care of modern maternity care that sometimes they were a little bit irritated about, but they just thought that was safeguarding their well-being. But they wanted to have skills to work within that. So this developed from my working with very conservative, faith-based people. We could then not necessarily lower interventions, but people could birth better. They could birth better by what they did, not by what happened to them. Right? And that was what I brought to New Zealand, the ability for us as families to birth better, no matter how their birth unfolded. It can't be a mixed message. We have moved from do what the doctor says to a choice-based approach, and we believe we need to move to a skills-based approach in a country that, thank goodness, has choices. I mean, real dynamic choices. New Zealand could lead the way by showing that a skilled burdened population supporting a midwifery model of care could, as Andrea's statistics will show, people who self-learn will self-reduce intervention rates, but even if they have interventions, they will feel better about how they birth.
As a profession, we taught natural normal birth. We couldn't define it, so we changed it to physiological. That actually, I think, has raised the bench even more, because what's physiological, totally all those are interventions, actually. So we've raised the bar even more and made it more impossible for women. So we have to change the message again, and so I don't believe we've got it right yet. Well, we're not seeing the happy births that we expect to see. You know, discussing ward birth, shiatsu, homeopathy, all those practices all still rely on a practitioner doing to the woman. Yes, they all help, but still, it's not. Very few of those are actually learned by the couple. That was the thing that surprised us the most, I think, was they weren't asking for the epidurals, they weren't ringing 5 minutes into labour, they were taking responsibility, they had skills to cope and get through those stages.
There's definitely been a tendency for sort of the medical interventions over here, natural health over here, or alternative, and lumping it all together. So people would often say to me, oh, well, people have a choice. If they want to use the pin kit, they can, but they're going to see an osteopath. And for a long time, it took me a long time to understand what is the difference. If you're going to have a skills-based approach to pregnancy and childbirth, then what are the skills that you want to see your families have some level of competence at? And in order to understand this, you have to have in your mind some analogy that says, well, how can we do this for the whole population? We're all so different, okay? But the reality is everyone blinks, everyone coughs, everyone can tighten up their rectum, men and women alike. We are one humanity. Doesn't matter what the color of our skin, what our religion, what our race, what our socioeconomic background is. Doesn't matter what our health is. We are all one humanity. 100% of pregnant women will give birth one way or the other, whether it is a miscarriage, whether it is a great birth unexpectedly in the backseat of a taxi, no matter what it is. Pregnancy inevitably leads to a birthing experience. 100% of the time. It's unavoidable.